Say to you, we're excited and delighted to be with you this evening. I'm Pastor Kendrick Curry of the Pennsylvania Avenue Baptist Church in Southeast Washington, D.C., and I'm just excited about what we have in store for you this evening. We have conversations with Dr. Gigi, and as you know, each and every week, Pennsylvania Avenue presents Hot Topics, and we're having conversations with Dr. Gigi, and we have some wonderful guests that she will introduce for us, and we will get started. Because today's topic, as we deal with maternal and children's health in this COVID environment, is something that's very much needed. And I know each and every one of you, whether you're on Zoom with the webinar or in Facebook land, we just want you to know that we have the topics here for you, and this is something you don't want to miss. So, Dr. Gigi, take it away for us.
Thank you, Reverend, and what a pleasure it is for Rodham Institute to be working and serving the Pennsylvania Avenue Baptist Church under your wonderful leadership, Dr. Reverend Curry. Well, today we start off with just a short update about what's happening in the city around COVID-19. Up until now, unfortunately, there have been 358 deaths in Washington, D.C. Around a little bit over 80% have happened in the African-American community. We are not quite seeing the flattening of a curve. We're still seeing an uptick, but nothing like New York City. But, you know, one person dying is one person too many. Right. We continue to stress the important messages of washing your hands. And now I'm actually including washing your face, because you can touch your face and, you know, bacteria or virus can get on your face. Masks of any type, paper masks, cloth masks, bandanas, masks that you buy from the store, masks that you make at home. And we just had a webinar with Dr. Laviste, who's the Dean of the School of Public Health at Tulane, who really made an important point. You know, there's a lot of fear in the African-American community, especially among men, about wearing masks and being mistaken, as always, as being criminals. But we have to keep in perspective, there are now more COVID deaths among African-Americans than really any other illness at this time. So wearing a mask really is a matter of life and death. The third thing is physical distancing, but not social distancing. And we're actually learning a little bit more. We were saying 6 feet, but now we're learning that if you're around somebody who's talking very loudly, it could be 10 feet. If, you know, somebody's singing, it could be 10 feet. We know that wearing a mask is really about protecting others because a mask can actually let small particles in. So if we all wear masks, we protect each other. And then we talked before about the importance of sleep and importance of eating well. But let me tell you what I've been seeing both in the hospital and in the clinic. I was just working in the hospital. Now we're beginning to see a lot of non-COVID patients coming in. And because they've been delaying their care for things like diabetes and other illnesses, we actually took one lady, I saw her in the emergency department, and she went directly to the operating room to have some toes amputated. So there's a big fear. And actually the reality is our emergency departments are really not crowded at all. There's about 50% less people coming to the emergency department. Then the other big issue is insomnia and anxiety. And, you know, we'll have our guests here speak more to that, because I keep telling people that you want to follow the same things that you do if you were putting a baby to sleep or a child to sleep. Without further ado, though, I'd like to welcome our 3 wonderful guests. And I'll start off by introducing Dr. Yolanda Lewis-Regland, who has been a guest on other webinars. She is really a special person who is a pediatrician, but also has added credentials in sort of weight management. And she actually started a not-for-profit organization for educating everybody about heart disease in children and in women in the African-American community. She's going to talk more about that. We also have Dr. Nicole Lang, who is a pediatrician and dear friend and actually a former medical student. Not that Dr. Yolanda is not a dear friend. She is. All of you guys are my friends. That came out wrong. Dr. Nicole Lang knew me when I was 40 pounds thinner and without gray hair. And she actually started a program way, way before anybody else was thinking about this, of giving new parents books, reading out loud to children through the book. She was going to talk about that. And so she's wonderful. And then our third guest, Dr. Javaka Moore, is just finishing up a C-section. So I will introduce him when he joins us. So with that, I don't know who, I see Dr. Nicole Lang is in the camera. I don't know how this works, but maybe we'll start off, we'll do it in alphabetical order. How about that? So Dr. Lang, would you like to introduce yourself and please share with us what you're seeing from the COVID perspective in your pediatric practice? Thank you.
Yes. Hi. Thank you very much, Dr. Gigi. I'm so thankful to be a part of this webinar and appreciate you inviting me. And I think it is important because the COVID pandemic has primarily focused on the adult world of medicine. And we're seeing now more and more pediatric cases that are coming up that are quite significant and can be quite critical as well. So I have my own practice, Washington Pediatric Associates. I used to work at the MFA at GW when they had pediatrics there, but I ventured on my own 18 years ago. And I've created a practice that is unique in the sense we have several services, one of which that Gigi mentioned, the Reach Out and Read program of giving out books to children's from very young age, infancy through when they start school. So they have their own library of books from their pediatrician when they start school. And to emphasize, parents are the first teachers, and parents are really recognizing that teaching role now that they're homeschooling their children. And another aspect of our practice is that we have a lactation consultant that helps new moms with breastfeeding. We also have nutritional counseling. We do a lot of preventative medicine work around weight management too, but also asthma and allergy prevention, trying to address things early on versus waiting for emergencies to occur. And we also screen for postpartum depression on all moms. And I think that's important because a lot of moms, and we're seeing it more and more now with the added stress of the pandemic, but many families need extra support. And now that they're not able to get that due to the social distancing or physical distancing, families really do need a lot of extra support. And so we're trying to help in that matter as well. What I have done in addition, in my practice, I train medical students, nurse practitioner and PA students from GW. So we're definitely committed to teaching the next generation of pediatric healers. And they work together as a team in my office. And so I think it's important for them, for all the different pediatric providers to learn from each other and to really help each other because it is a team approach. The thing that we have done differently since the pandemic started is that we are seeing patients more on telemedicine, but also newborns have to be seen. The pandemic has not stopped babies from being delivered, as Dr. Moore will attest when he comes in, as he just delivered a baby by C-section. But so we are seeing newborns and young babies age 4 and under that really do need to still come in for their vaccinations. Having babies vaccinated against preventable diseases is still very important and really should be a top priority in families' lives. We've seen the problems when the children are not vaccinated, for example, outbreaks of measles that have happened in the recent past. So vaccines are very important. And so we're trying to call families and have those younger babies come in for those well child visits. And I'm spacing out my visits really to 1 patient per hour. Even though we have 6 exam rooms in the office, we're trying to, again, be very conscious and have safety as our priority and making sure that everyone wears masks and we wear masks, gowns, and gloves, my staff and I, and we're just seeing 1 patient, again, per hour so that we can help minimize any exposures. So we another thing that we try to do for families is to focus on mothers taking care of themselves and fathers too, but primarily mothers, because we feel like postpartum depression deals primarily with the females, but it can be in both categories. But taking care of yourself, taking breaks for yourself is important so you can better address your children when their needs come up. So those are a few of the things that I wanted to mention. And I'll stop there. I can keep going on and on, but I'll pause there.
Thank you so very much, Dr.
Okay.
Lang. We will come back to some of the items that you have sort of outlined in your opening comments, and we really want to get into some questioning after a period of time so that we can really hear from those who are out in the community on the ground, and thank you. So we will go now. I will let Dr. Moore catch his breath. I know he's just completed a C-section, and I just praise God for him because of what has been done. So we will come to him momentarily. But Dr. Yolanda Lewis-Ragland, would you please introduce yourself and give us some opening words about what you do and your practice as one who is in the community, on the ground, as a pediatrician.
All right. Well, so first of all, I'd like to say that Dr. Lang laid out pretty much what we're all doing very well. So I want to thank her for that. So at Children's National Medical Center, I'm actually in the Southeast Clinic. I'm at the ARC. And where most of us know Ward 7 and 8 are, that's where, it's where my heart is. It's actually where I live and where I've served for over 15 years now. And what we're doing, similar to, as Dr. Lang said, we have a multidisciplinary team. We have social workers that are in on-site. We have a psych, which is on-site. We're seeing a lot of our patients that are dealing with not just postpartum, but also families that are affected, by COVID deaths and by COVID illnesses, morbidities. And so we have a lot more of our social work team is actually working a lot more with our families because of these services through telemedicine. We're able to give them telemedicine visits versus them coming in. We have over 20 exam rooms in our clinic. So what we've been doing physically in terms of distancing is you come directly in and you either go to a sick side or a well side. So we're able to triage prior to them coming in. They only come in if those who physically come in, if they're not 4 and under, seeing them for their well visits and their vaccinations, then they've already been triaged through like a telemedicine visit. And then a physician has determined whether they actually need to be physically seen. But of course, we're still seeing our teens, for instance, that may need contraception. We're going to see. So that's still going to be on the well side. We don't want anyone out here not getting their depot or not getting their, testing for other things, because it's not just about COVID right now, right? Our teens still need to be seen. Our children, small children need to be seen. There's certain rashes and things that we can definitely see on telemedicine, but there's some things that don't lend themselves to telemedicine very well. Are able to still see patients inside, but the distancing, we're doing a very good job at that. We've had a few positive cases that we've tested and been able to isolate. But for the most part, if we think that there are symptoms, when we do a telemedicine visit, we're sending them to testing sites so that they don't have to physically come in and expose our staff as well as other members of the community or other children that are there for well visits, right? So we don't want to get anybody sick because somebody else needs to be tested. So we're doing a lot of those things, but I think that we are, in terms of what our services, we have literally just everything we talked about. We have lactation, we have, psych services, we have WIC that comes to our site. Right now, WIC is doing most of their services also through telemedicine, telephone visits, and through the ability to just do things over the phone or over the computer. So we're trying to keep as many of our families safe and at home as possible. And so we're really limiting as much as we can, anyone that has to come in, especially with small children. And on top of that, they're homeschooling, right? Their kids, and having to really serve in these other capacities that they've never served in before, which is a lot of stress we're finding on our parents. So we've actually instituted weekly seminars with our parents on lowering, how to deal with stress, how to deal with managing their time. Time management is not something you had to think about prior to having a child who has a whole schedule for school and you have a whole schedule for work, or even if you were a mom, you never had to manage their time as a child for their schoolwork. So we're working with them on time management. We're working with them on anger management. We're working with them. One of the statistics that's higher right now in all communities, but specifically in our communities, is domestic violence, partner abuse, in this time of quarantine and confinement, where for some reason, places like liquor stores have been essential and they've been open, right? So you've had a lot of folks who've been having access to things like alcohol, but quarantined at home with their families. So that hasn't been a great mix for our children and for some of our families that are suffering from domestic violence and from child abuse, things like that. So we've been a lot more accessible and really forward in having these weekly meetings, these drop-in meetings for parents, these Zoom meetings that they're able to come in. Our social work team and our psych team has been doing. It's really just a parent support group, and it's grown. And I think parents are getting out of that. Also about, ways to engage smaller children, how to figure out time management between children of different age groups that have different needs. So there's a lot of things that I'm sure maybe there are some questions about, but those are some of the things that we've really been addressing outside of just sort of the typical medicine that we've been addressing. A lot of our pharmacies we've been talking with about having them deliver medications versus parents having to come pick these medications up. And so we've done a lot more of that, of delivery services. At the ARC itself, we're part of the program that gives lunches, breakfast and lunch out to people. They come and they pick up a breakfast and a lunch at the ARC location. So it's just been a lot of, community engagement and as much activity as we can provide. And so we're seeing a lot more of our families come in and participate in some of these services. So.
Well, that is extremely wonderful. And I thank you for what you do in the community. I'm, as a Ward 7 resident and spending a lot of time between 7 and 8, thank you so very much. And we will continue to follow up on the things that you've shared. Dr. Moore, please come off of mute and share with us the wonderful.
Hey, JB.
Everybody ought to say hello.
We went to Howard together, Howard Med School. So.
I know. Oh my God, I haven't seen you in so long. Hi, everybody. So, I'm just listening to the last two of you guys talk. It's very impressive what you all are able to do. For us, it's a little...
Wait. I'm going to stop you because I have to introduce Dr. Javaka Moore. Mm-hmm. So let me tell you about him because he is really he's an incredible human being. Dr. Moore, as I mentioned before he came on air, is Howard trained. He's an OBGYN, and he has 5 clinics in Maryland. And he has a 0 maternal mortality and a 3% C-section rate. And right. How his philosophy is really prevention, prenatal care. It's a holistic philosophy. And it's not only a philosophy that he extends to his patients here in DC, he actually does international work and works in Ethiopia and in Nigeria, in Ghana, I think in Morocco, he just started. And Dr. Moore wanted to open up a clinic in Southeast and opened one indeed in mid-July, thank God, because, and that's at the United Medical Center. And it's so important because I'm not sure what those women would have done without you, frankly. We were going to award him the Rodham Institute Beacon of Light Award for 2020. We actually had a little video made about him, which was delayed because we were supposed to have our summit March 12th. But stay tuned. We will definitely be awarding him this Beacon of Light Award because that is Dr. Moore. And I'll stop there.
Right.
Thank you so much. Very humbling. Well, yeah, I mean, I'll be brief. For, our focus is obstetrics really, and what I found in the initial stages of the pandemic, we basically streamlined all of our services to just take care of pregnant patients. But of course, what we found is that there are a lot of people that actually have serious gynecological problems, and if we don't address it in the office, they end up in the emergency room or urgent care, and then they're at higher risk of contracting or coming in contact with COVID-19. So what we've done is pretty much try to make care as accessible as possible for patients, but also get them in and out in an efficient manner. All of the waiting rooms, most of the waiting rooms are actually pretty large, and we limit guests to just one accompanying person for pregnant patients, and for gynecology patients, they have to come by themselves. It's been pretty seamless so far. We haven't had any issues. What we found is that we're getting a lot more pregnancies than usual, which is understandable because everybody's at home. Yeah, but so far, so far so good. We've had a few patients with COVID-19. Actually, I think we're supposed to deliver one tomorrow, but we haven't had any serious issues. Nobody's been very sick. All of our staff, they have N95 masks available to them, and we use all the precautions pretty much that you all mentioned. Actually got a couple good ideas from listening to you all that we'll look into. But yeah, that's basically it. We're just trying to keep up with all of these babies. And Yolanda brought up a good point about contraception and all of these things that initially we wanted to kind of stay away from, but of course those things end up, it's not just COVID-19. We have all these other issues, and on top of that, we have very limited access to care. So I just made the decision that we're gonna just try to see patients, as we typically would, but just be smart about it and just try to limit the exposure as much as possible. Mm-hmm. I'll leave it at that because I know we have a lot to talk about, I'm sure.
Yeah. Well, I think each and every one of you, and certainly thank you, Dr. Moore, and I'm glad to even learn even much more about you from Dr. Gigi. And I would like to open it up for those who are in the audience. Feel free to put your questions in the Q&A or in the chat sections on Zoom, and we want to get started with some opening dialogue with around, this day of COVID-19, this particular pandemic. How can pregnant women guard their health as well as the health of their unborn child, as well as the health of their children in this age? We're hearing a whole lot about babies and young children in regards to the COVID-19. What can parents do, in particular our women, in terms of guarding their unborns, but also let's look at how you protect children in general. What can we do? What are we missing, if anything? Who'd like to start?
I mean, I can go. The first thing I'll say is that COVID-19, again, we're not in a vacuum. Pregnancy in itself, it can be pretty high risk. As an example, every couple of weeks we find so our standard approach is to do ultrasounds on all of the patients, all of the pregnant patients for their initial visits. And we come across ectopic pregnancies and things that are life-threatening.
Yeah.
And so it's easy to say. I mean, I hear people say, we have to see patients less and do all of that, but these people can end up dying from these things if we miss them. And I'm sure when the dust settles in general throughout medicine, you'll see that we have a lot of COVID-19 deaths, but we also are going to have a lot of deaths that may have been preventable in terms of myocardial infarction and stroke and those things that people are afraid to come to the hospital, afraid to come even to the doctor's office. So the first thing I would say is to continue with prenatal care and continue pretty much with the schedule that you would otherwise have as a pregnant patient. We've had patients miss multiple appointments because they were afraid of coronavirus, and again, you do that, and you end up with I wouldn't say a more serious problem, but there are serious issues that can happen just with pregnancy. As far as the protecting the babies, probably the number one thing I can think of, again, I'm not a pediatrician, but breastfeeding. I mean, it's a good opportunity to really hammer home the importance of breastfeeding for patients, that you should be able to pass on some level of immunity through the breast milk to the babies. I'm guessing that hasn't really been studied specifically to COVID-19, but I would imagine that at a minimum it's not going to hurt, but most likely it's going to help in terms of protective thing. But pregnancy itself, this is really new. There is some question as to whether it increases the risk of miscarriage and those things. Again, you go back to the general principles of just staying at home unless absolutely necessary, and using masks at all times if you're going outdoors. And that's about it. I think you all can probably speak better on the other stuff.
Yeah. So, I mean, I want to talk a little maybe about protection when it comes to nutrition. I think that Dr. Moore is very right about what breastfeeding, how important breastfeeding can be, right, for your small child and the immunity that we are able to pass along. And one of the ways that sort of I spoke in the other webinar about that we sort of increase our immunity, our immune systems, boosting our immune systems. You can actually do that with nutrition. This isn't just for pregnant women and for children. This is really about everybody, but very specifically for women and for what they should know about their own immune systems, what they should know about their children's immune systems, is that we're trying to boost our immune systems with, fresh fruits and vegetables, increasing your pH. There's certain things that are alkalinic versus acidic. Things like soda and lots of sugary drinks and cereals. They're very high in sugar. That means they're also going to be acidic in your system, which technically is like a toxic system, and that lowers your immune system. So not only do your kids have to run around and trying to get this energy out indoors, not only is that probably a bad idea for giving them a lot of sugary foods, but it's actually also not great for their immune systems. It causes inflammation and it actually weakens the immune system. So in order to boost their immune system, in order to increase their ability to fight off anything that they might be be affected by or faced with, we will give more fruits and vegetables, more alkalinic foods. I think I talked last time about avocados and pineapples, and there's dandelion tea, alkaline water, but there's all kinds of ways that you can use nutrition to do that. One of the things I also want to say about children is I see a lot of parents that when they are out and they do have their kids out, they have masks on their children, and the masks are really too big. They're falling off of their faces. They're loose. And if it's not fitting on their face, it's not protecting them. So, maybe you can't get a small one specific to your child, but you're going to have to figure, you can tack them, you can make them a little bit smaller. You can take that loop in but you want it to fit across the face. well, otherwise you're really not protecting your child. And so, many times I'm walking around and I'm seeing parents and they don't really realize that they're not, I think in theory, they think they're protecting their children, but they really aren't, because the masks are too big, they're falling off their faces, things like that. So yeah, it's the same thing. Do you want to do your mask? Do you want to have, washing your hands, the gel, all of that stuff when you're out, not having them touching anything, wiping down, baskets. But the truth is, try not bringing them out if you don't have to. I'm doing whole families in stores. I don't know that it's necessary that everyone should be in the grocery stores together. I think that if we can, have one person go out and get what's needed and come back, I just think that's so much safer. And I get that people are restless, and I get that they want kind of to get out. I just don't think that the stores are the places to take the kids. I think that, yeah, definitely we encourage you to get out and get some air and get some activities and exercise, but we can do that outdoors, away from others, let them, sort of run around, not on park, like equipment, things like that, because again, those are surfaces. We're not trying to get them to use surfaces. We want them to maybe just run around with each other. Whatever thing you got to come up with. We got to be more creative, but we do want them getting an activity. But we just, as much as we can, keeping them from places like stores and indoors with others, because it's difficult to explain to a kid why you got to stay 6 feet away from someone. That they don't know. Kids are so drawn to each other. I see it all the time in the store where they just keep each other, and you're not trying to be a mean parent. You're not, you don't want to keep your children. So it's better probably to keep them out of the stores. But anyway, that's just one of the things I first thought about when he said that is nutrition. We can use nutrition to actually boost our, and there are ways that we're using nutrition sometimes that actually impedes our immune systems, and we want to stay away from sugary, like I said, sugary cereals, sugary drinks, sodas, juices. A lot of these things, give a lot more water, fruits, vegetables, anything you can do to alkalinize their system that will actually help boost your immune system. And right now, vitamin C, zinc, selenium, there are vitamins that are also that we can be using, not just as adults, but as children, that we should be more aware of right now, if that makes sense.
Yeah. No, I agree with both of the other speakers. And the other thing that can help your immune system is getting enough proper sleep too. I think that in addition to good food being good medicine, proper sleep is also when your immune system gets revved up. And so I think that's critical too, to try and have some semblance of a routine, a sleeping schedule, and more family dinners and eating time together has been happening. But also more playtime and getting outside. I agree with what you said, but try to contain who's exposed to the children. But I do think, making those smart, healthy, safe choices of eating well, sleeping well, and also staying connected, because the social emotional development of a child and the relationship building, whether that's virtual over the, Zoom calls or Skype or iPhone, FaceTime. I think that's important, just so the children can stay connected to their relatives that normally would be in their home with them. So that helps their overall health and well-being, staying connected, eating well, and sleeping well.
Can I ask a question, Dr. Lang?
Yeah.
Because I mentioned sort of at the very beginning about sleep hygiene for adults, and the model that I'm using is the same sleep habits that children are good for kids. Can you just sort of review that? Because I'm finding that people don't necessarily know what that is. So if you could review that with us, I think it would be very helpful.
Right. Well, I mean, in essence, the more sleep, the better it is for you overall. Newborns sleep sometimes 14 to 16 hours a day. School-age children, it can be obviously less. It'll be probably 10 to 12 hours, sometimes longer. But on average, even teenagers, they need at a minimum 8 hours of sleep or more. But the more sleep, the better.
And what should that bedtime routine be like?
Well, you want to minimize screen time before you go to sleep. You want to also, in regards to that, minimize watching the news, especially for children that really aren't able to really interpret the extent of what's happening and what measures are being taken to help save lives. And a lot of times the news is more negative. And so that can make families more, or children especially, more anxious with their understanding. And so I've gotten many more calls about high anxiety and stress and depression than I've had in the recent past. It's been quite escalated on a daily basis. I'm talking about anxiety. And so really minimizing the negative influences that are coming at children, especially before bedtime, because if they see or hear a lot of negative things, they're going to have a hard time falling asleep, or they keep waking up in the middle of the night. So I think that's important. But to have for younger children, a set time, or roughly a set time, to go to bed at the same time every night, and whether that routine involves bath time, story time, brush your teeth time, and go to bed. Sometimes it's important for them to have a little lovey or stuffed animal or blanket to sleep with, not babies. I'm talking about school-age children or toddlers. So I think it's important to have some sense of security and safety, reassuring the children that, we're doing our best to keep you safe and protected, and also focusing on positive behaviors. A lot of times parents, you'll hear, the focus is on don't do this, don't do that, the negative behaviors, but really children need to hear the positive things too, and that helps their overall well-being as well.
Could I just follow up with that and just ask you to just expand, if you will, and say more about what can parents do to deal with the mental health of children during this age? You minimize screen time, I get it, but we're staying home more. We're not out, so we have the nervous energy. I heard Dr. Ragland talk about the sugar and all of the other things.
Mm-hmm.
How do we deal with this in terms of just mental health?
So, I think one of the things.
Well, many more children, I think, are acting out.
Oh, I didn't hear. Go ahead.
Go ahead, Dr. Lang.
Oh, no, I was saying many more children are acting out, and their behavior is really out of sorts. Sometimes they may be more clingy, or they may have more anxiety, again, with sleep, or just different behavior in general. I spoke to a mom yesterday that had her 6-year-old who was really out of sorts, and he was actually able to express himself. And he said to her, I miss my teacher, I miss my friends, I miss my playground, I want to go back to school. And he just really was having tantrums, and he didn't really have tantrums as a 1 or 2 year old, which you normally see in that age, but he was having one now. And so the mother called me really in a panic, saying, I'm, just out of sorts myself, and I had to go take a break and then to come back and to help him. But she was able to reassure him that, yes, we're doing the best we can. I love you, I support you, and to help. But you will see more and more children acting out, and or sometimes they become more withdrawn and they don't want to participate in family activities, or if they're in their room alone and really not doing their school work. I've had a lot of parents tell me they're having a hard time getting the children to do the online school work for the teenagers especially. So it's really a matter of seeing if they can express themselves to tell us how they're feeling. I've referred a lot of my patients also to psychologists or psychiatrists that works with my office. And so I think that's important to have an outlet, whether they journal it out, they can draw pictures about how they're feeling, or talk it out. And also to encourage more mindfulness practices, I think, is important.
Yeah. So what I actually was going to say as well is, when we're talking about routines, this is actually important with adults and children. But like, for instance, I was finding what we find, and, I've just had a lot of conversations with parents that they're having a hard time, especially with, like, say, the schoolwork versus homework, really sort of organizing a space in home that's sort of like school space, and able to actually have space that's not school space. even people who would like find themselves working at home and teleworking, having to figure out, this is where I'm going to do my telework from, this sort of quote unquote office space. Set something up, organize it. So helping your kids and let them be involved in putting their little sort of classroom together. We've just been doing a lot of practical things with parents. So let them what their little classroom looks like, what that setup looks like, let them be involved in that. And then when that time is over, they're away from that space and then they're able to do other things. I think finding things to do as families, whether it's putting puzzles together, whether it's board games, but finding things that they can actually do. Like sometimes what parents are finding is that they just feel like they have to be engaged all day long. They have these smaller children and the kids need them, sort of every step of the way. And that's very different for them. But finding activities that kids can actually do that's age appropriate, that's sort of on their own, but you're still able to supervise with them. So jigsaw puzzles, crossword puzzles, things that they're able to sort of do on their own, because we are talking about, like you said, we're talking about decreasing screen time, but that's the one thing you have in the space with you are the screens, right? So of course the kids want, or they have more access to screen time. What do you mean decrease screen time? Well, what are you replacing screen time with? So you got to find something to replace time with.
Right.
Yes, I also think that another thing that we've been recommending that seems to be working very well, other than this, and maybe they can do this on their own, find other parents who are having we've found a lot of homeschool sort of organizations that are allowing parents who've never homeschooled before to get in on sort of Zoom meeting, find out, what are some tips? I've never had to ask about homeschool tips. I've never tried homeschooling my kid. I never thought I'd be here homeschooling. So what do you guys do? How do you put a schedule together? How do you organize this? But having these sort of support groups for parents, but it's just as important to have these groups for kids, right? So I've talked to a lot of parents who have had Zoom meetings. They've set it up for their kids. It's almost like a virtual sleepover, right? A virtual party. We have these virtual things, just like we're connected now. We're finding ourselves meeting as an intellectual, academic institution and individuals. We need to be connected just to talk like this, or our kids need the same thing. They don't just want to hear from grandma and aunts and uncles. They want to hear from their friends. So reach out to parents, reach out to their friends, and set up a Zoom meeting and let it be something that they know they're going to do on Fridays. Friday at 4 or Friday at 6, they're going to get with their friends and they're going to have their own little virtual parties. The kids need just as much social connection and activity as you do. And I really say to parents, anything you kind of find yourself needing, your kids probably need it too. You just got to find creative ways to get it to them. But having just real conversations with them about, how does it feel, that you're being sort of homeschooled? How am I, get some, how's mommy doing, as a teacher, like, how do you feel about, what we're doing? I think we don't ask our kids enough, how they're feeling, and we kind of need to get a little bit of their feedback. We want to know how our teachers are doing for our kids and their academic lives, but now we got to find out what's our grade, what are we doing? What can we be doing differently, and how can we get connected? And you don't have to do it all on your own. That's the other thing as parents, finding out that there are other parents who might actually be better at you might be able to do math together in some small family, some small group of parents with their kids. They might be doing the same math. There's some math that they're doing that I didn't have to go through. I'm listening to parents now. I'm so happy I have a high schooler, because there's this stuff going on with math that I didn't have to do, this new math. So I'm listening to parents getting together in groups with their kids. But I'm just saying there are things that we can do that are practical, as well as, I think sometimes parents feel like we give them information that's sort of theoretical, and they want to kind of know, like, oh, I hear what you're saying, but physically, what should I do? So I'm saying, get some age appropriate, puzzles and crossword puzzles, things for them to do. If you're going to take screen time down, then you got to replace it with something. And so maybe those are some of the suggestions that we have.
Well, definitely. Thank you both, Dr. Lang and Dr. Lewis Ragland, for those tips. Dr. Moore, can you not only speak to the mental health, but more specifically, can you speak to the mental health of the pregnant mom and the baby's development?
As it relates to this new environment, to COVID-19?
Yes, as it relates to the new environment.
So usually, people, as far as the pregnancy goes and the development, and talking to all of the patients that we see, I haven't really seen people be too worried about that. I think it's still pretty clear that it's not some terrifying thing compared to, for example, the Zika virus a few years ago. So that aspect of it, I'm not really seeing people too worried about it. They usually worried about, who's going to be in the delivery room. Is dad going to be able to be there? Are they going to be able to have a guest? The hospital that we work with, they allow just for one visitor, and usually that's the father of the baby. So as far as that is concerned, strictly with COVID-19, I haven't seen too much of an issue. However, our patient population has to deal with a lot of adversity even before they get pregnant. And they're pretty used to adversity, in Washington, D.C., before we put our office in Southeast, I had my staff call all of the main prenatal care providers in DC, and patients had about a 6 to 8 week wait for their first appointment. And so just imagine being pregnant, finding out that you're pregnant, and nobody is going to see you for your prenatal care, and all of the anxiety that goes along with that. We have patients now with DC Medicaid insurance that we can't find a perinatologist to assist in their care, their high-risk pregnancy care. Like literally, we have to kind of just ask people to see them or see what we can do, and to go above and beyond to take their high-risk care. So, they're used to adversity. So something like COVID-19, and when we even go into postpartum depression and all of those things, I mean, my take on it is that, a lot of patients come in thinking, because they hear, African-American women are at increased risk for basically everything bad, right? And that's always uncoupled from the fact that, our living conditions, our working conditions, our transportation conditions, all of these things they really predispose us, and in particular, pregnant women, so a lot of issues that a lot of people don't have to face. So again, when you're talking about these things, these mental health things, as far as I'm concerned, you really need to take a step back and just look at how these women are treated in our society in general, and start from there. Because if they have all of these issues, they can't get care, they can't get, we're not even going into the dietary aspect of it and housing and all of these other things, then yeah, of course they're going to have issues, not only with increased exposure to something like coronavirus that is going to, again, you talk about people that are living close together, working close together, using public transportation, and they don't have a choice, and then on top of that, they now have financial insecurity because they may not be able to go to work, their kids can't go to school. I mean, all of these things put together, they're gonna have issues. But I will say, at least from the patients that we encounter, unfortunately, this is just one situation out of many that they've had to deal with for a very long time. So I'm everybody that I've seen with it, they've coped very well, at least, and I can only speak to what we experience as a practice. And it's unfortunate. And I know Gigi is doing a lot of work in terms of bringing to light all of these health disparities that we face. But at the end of the day, it's gonna be incumbent on us to do these things and to fill in these gaps for ourselves and our women. I mean, I'm not holding out hope that anybody else is gonna really deal with these things. So we have to really go above and beyond and do the kind of things like what we're doing now to come up with different ideas and strategies.
Well, thank you so very much. I do want to have all of you, if you would, speak about the Kawasaki-like illness that has caused some death among children, and it is some feel that it's been due to COVID. Can you really share some more information in and around this whole Kawasaki illness?
Mhm. Sure. So basically, what they found with COVID-19 is a coagulopathy, if you will, that occurs and is one of the systems that's affected in the body. And so for children, there's been for years there's been that was associated for deaths among kids was something that was connected to for instance, streptococcus, and it would cause, if it was untreated, it would be turned into Kawasaki's. And there were, you would see some lymphadenopathy, you'd see a particular type of rash, you would see, all of these sort of internal changes that were happening that were associated with this coagulopathy, and it can cause death. One of the issues is that, obviously we're hearing, only older individuals are affected, or only those with sort of comorbid sort of illnesses already with hypertension or heart disease and diabetes, and all of that is true. But it also is that children who have no illnesses prior to that can have this coagulopathy occur and have this this disease process, and it can actually kill. We've had children at Children's National in the ICU. We've had cases, and they're small numbers, but that doesn't mean that they don't exist. But when you look at it nationally, those numbers are significant enough for us to take note. Another thing that's very interesting, though, that we have to be really concerned about is that, again, as Dr. Moore pointed out, pregnant women are not in a vacuum, or neither are children. So these children who, we're talking about opening up schools and opening up, rec centers or whatever we're talking about opening up, not only are they going to be affected by this Kawasaki-like disease and can face situations where they may actually die, but even if they recover, let's say they do, most will, they're going to now be vectors, right? And so they're going to go in homes where we have, especially in our community, we tend to have multi-generational families. Mm-hmm. So kids are actually then going to expose grandparents. And then very specifically, they're going to expose family members that have the comorbidities that we're talking about, right? One of the reasons that I started, as Dr. Gigi was talking about earlier, this foundation and really this education on heart disease is because it's the number one killer outside of COVID now, right? But it's the number one killer in our community for men and women, and specifically women began to actually outnumber men for heart disease. And so here we are with hypertension and high cholesterol and all these things happening. Well, if you have these children that are now vectors, they're going to now expose mothers and aunts, and we tend to have these our care-wise, we tend to have various people in the home taking care of children in terms of grandparents and aunts and uncles and extended families, if you will. And so that's actually my real concern, is not just the disease process that it occurs in our children who may actually recover and seem to do fine, but the people that they're then going to expose, they're going to expose to these to the virus, right? Who are not going to do so well. And one of the things I do want to touch on that Dr. Moore was talking about the pregnant women, who don't. There's so many other adversities, especially in this community, and they seem to do fine, and that's all true. But what happens is there is a neurodevelopment of a fetus that is affected by what we call ACEs, right? We talk about this all the time. Really don't realize that we control, and we seem to accept and seem to do fine with a lot of these stresses, but we actually don't really realize the impact that it's having on the neural development, that access for a fetus. And so the more sort of anxiety and stress and issues that these women are dealing with during their pregnancy, right? The more that they're facing, and now they're facing more because of what's happening maybe with family members that are dying. We have a lot of people that are actually being affected and dying, and they're not being, they can't go to funerals. So they have a lot more grief. They have a lot more stress. There's a lot of stuff happening. We may not necessarily manifest that as an adult outwardly, but we are increased cortisol. We have the increased stress hormones. We have the increased anxiety that's happening that is affecting the neurodevelopment of that fetus. And so we as pediatricians are also, we are concerned about happening with increased stress and anxiety in a pregnant woman during this time, and during any time, but specifically during this pandemic, because it's increasing our anxiety, it's increasing fear. Misinformation and disinformation is increasing fear, social distancing, increasing isolation, which is increasing depression. So it's increasing a lot of things in our pregnant women, in everyone, but specifically in pregnant women, that is going to be affected, that is going to affect these fetuses. And it is something that I believe we're going to have to take a look at when we start going back over, retrospectively. What are the children that were born during this time? What are some of the concerns? What are the cognitive issues that we're finding? What are the behavioral issues that we're finding? I believe that there's a lot of kids that are being, because of as Dr. Lang said, because they are, the social development of children is very much connected to their cognition, right? To how they learn and how they behave. There's a lot of things we've broken that access and that axis rather, and now we're trying to figure out how to reconnect them in these very odd ways that we're still trying to figure out. And so I don't know how well we're doing at it, and we may not know how poorly we've done it until we have to retrospectively look back and see, like, what are some of the things that some of these children during this time experience and have been expressing. So I really think we're gonna have to do a good study on what are some of the things we did a good job at, and some of the things we probably didn't handle so well because we weren't sure what we were doing.
Oh, thank you so much for your answer. There's just one thing I wanted to clarify for the audience. Could you just say and explain what ACEs is?
Oh, I'm so sorry. Yeah, so ACEs are adverse childhood experiences. And there's a lot of information out there. Dr. Nadine Burke is one of the top pediatricians who's written a book on it. But it's just the idea that there are certain events that occur in a child's life that causes them to have certain reactions to things, and it's things like domestic violence, poverty, chronic illnesses in family members, seeing someone die or seeing someone hurt badly or losing someone in
Actually,
their life.
if I can jump in, because people can actually go online, and there is a 10-item questionnaire where you can answer them. These are events that happen to you before the age of 18. And what's so sad is that these actually correlate not just with mental illnesses, but with physical illness. So people have a much higher rate of, emphysema, of cancer, of diabetes, of being smokers, of actually perpetuating domestic violence. And this really all has to do with things like poverty, right? All of that, and poverty and educational systems. But I have one question for you, Dr. Lang, because I've been so concerned about how kids are doing in terms of education, particularly in communities of color, where I don't know if every child in Ward 8 or Ward 7 has a computer. I don't know if there's internet. I don't know if there's smartphone. I'm saying I don't know. I do know. I don't know what proportion don't have it. So kids who are already at a disadvantage, and then they're missing all of this school. Dr. Lang, can you talk about this? Because I know, to be held back in school can be a very demoralizing experience for the child and the family. anyway, can you speak to that?
Yes, no, this is a very difficult time for parents in particular who are now the teachers in addition to working from home as well. So that whole balancing act is very difficult, but I think it's very critical to work for the parents to work with the teachers and with the school systems and to get the extra support and to partner with them, not for them to feel like they're alone in the process, but that there are supports out there. And it is difficult when the resources aren't there, but there have been more programs in place and more people donating computers and books and school materials to children that are in need. So I do know that is happening, although I'm sure it's not 100%. But I think it's so important because the children really do need that continual learning feedback, if you will. They need to continue this on a daily basis, and the parents need guidance and support to help them along the way. And so as having the parents ask for help, having the school systems and whatever supports that can supply that, I think is really critical in this time period. And when they don't know, to have resources like the Rodham Institute that has a whole list of many different supports in the community. Children's Hospital has a lot of different supports, the Department of Health. So it's just a matter of figuring out how to get the support system and resources to those that are most in need. But it is definitely a worrisome time.
We're actually about,
and go on. I'm sorry.
We're actually about to start a program where if you, either one of you, any one of you, have kids and parents that need help in terms of one-on-one tutoring, Rodham is going to start to pair people up with students, with faculty, with seniors, because I think sometimes it's just that one-on-one, and navigating some of the resources can be very difficult. We're actually about to announce a film fest that we're going to do for kids to compete in. We're going to have, actually there's a platform so we can actually have a film festival that will be them creating 3 to 5 minute videos on living during the time of COVID. So we'll be pushing that out, and that's just a different way of engaging kids, because I am very worried about what's going to happen, not just physically, of course, that's the immediate concern to children and in terms of their nutrition and all that, but also in terms of their education, because it is this one of the most crucial social determinants of health and predicts how long you live.
Absolutely.
Absolutely.
You know, I just want to jump in right here. Our time is just going by very quickly, but I do want to make sure that for those who are in the audience, I know I got some questions early. Can you say anything, Dr. Moore, Dr. Lane, Dr. Ragland, anything about what postpartum depression is and how do we begin to deal with this and wrap our arms around it? It won't only be the children. All of us will have some degree of stressors that are on us, particularly those who have I would say those who have had children, but also this PTSD that we all will have to sort of process going around. Are there resources for postpartum pregnancies and dealing with that? And what do we really need to look at to really sort of monitor ourselves and guide ourselves? What are some of those indicators that we're really going through? Dr. Moore, I'd like you to start.
I honestly don't think we have enough time to really do that topic justice. I will say that as difficult as it is to diagnose postpartum depression or to even realize it, whether it's as a clinician or, you know, as he's looking at a family member, it's going to be that much more difficult now given this situation, because, you know, I don't think any of us have ever really experienced anything even close to this, and people are gonna have their own reactions and their own issues just because of COVID-19. You know, that's gonna, Yolanda was talking about later on unpacking everything that has happened now and coming back to study it. And I think not only the issues related to children, but pregnant women, family members. I mean, because as I said, we haven't had any sick patients, but we've had patients with family members, and actually staff members with family members that have passed because of COVID-19, and that has a serious effect on these people that I don't think we're even going to see the full effect of it anytime soon. But going back to postpartum depression in general, it's it's just a change in the state and the mood that you can reasonably relate to pregnancy. But again, going back to, I'm always amazed at a lot of our patients and how they're even coping with the issues that they face in general. And I always tell them, like, just have a healthy respect for what women have to go through. And I also see it in the fathers as well. But I think to do that justice, that has to be a separate conversation, because we're really up against it in terms of time.
And I'm excited about that. Perhaps that will be another webinar going forward, because that's something that many in this community are asking for, and they really want to know how do I begin to cope in this particular time. Dr. Lewis Ragland?
Yeah, I mean, what I will say about it is that it is one of the things that we screen for when parents do come in, when they first bring their newborns in, when they've had a baby. We'll do something called the Edinburgh screen. And as Dr. Moore said, it's not this easy thing to unpack, but we do screen for it. We try to determine one of the problems or one of the issues that we're concerned about is if a mom is like really just not emotionally moved, when her child is crying and needs to eat, or just needs attention. The mom is less, just doesn't feel like there's much she has. She's already so depressed and so burdened and so overwhelmed that doesn't feel like, she can give the type of attention she needs to the baby. And sometimes they don't even recognize that they have it, that they're not attentive and that they're not, so it's very difficult to sometimes even diagnose. And so as Dr. Moore is saying, with everything else that's going on, we're not sure how much of it's going to be just because of postpartum and how much of it's going to be because of all the other stuff that you're also that you're negatively affected by, really. So, but we try to screen for it. But I mean, there's just a lot. I mean, yeah, and I just appreciate being able to share. The last thing I wanted to say is about education that Dr. Gigi was talking about, whether everyone has computers and access. Really, the other thing that's kind of scary is that your ability to help your child educationally really depends on your own level of education. So we haven't even touched on the fact that in some of our communities, our parents are not high school graduates, that some of our parents, have their own limitations. They have their own mental health limitations. They have their own cognitive limitations. And now you've asked them to now be not just a caregiver, and they get much respect for being great caregivers. But now I've asked them to be the educator, and they've not been trained. We didn't give them any prior training. We didn't give them technical training. We have parents that were expecting them to get on these Zoom meetings. I've screwed up a Zoom meeting or two just trying to get on because I couldn't figure out the meeting ID. And so you're asking parents to get on Zoom meetings and contact, the administrators and contact the teachers and their limitations. It's so, it just breaks my heart that we're expecting so much of our parents and not being able to actually physically give this stuff to them because of the social distancing. So we're just, again, I think we're going to find out much later how many of our children didn't have access to the internet.
But you know what? This is where I'd like to jump in, because sadly, only 42% of children graduate from high school in Ward 8. And one thing that Dr. Moore has said is that for communities in need, not only do they need the basics, they need more to make up for what's missing. So what I ask you, Dr. Curry, Dr. Reverend Curry, and other community leaders, we want to know in real time, and for you, all the physicians that are on this panel, what your, patients, what your congregants, what community members need, because if nothing else, we have a vast network. We've got over 100 partners, and we can do our very best to, reach people now, because time is precious, especially for children, and we are very committed to making a difference right now. So you just tell us what you need, and we will do our very best to make it happen. And if we can't make it happen, we reach out to people that can.
That's right.
Right.
Well, I'm so grateful to each and every one of you for this time, and it is something that we very much need so that we will be able to live and thrive as a community. I will tell you, we could have a whole nother session on education, which is another one of my passions. And that there's a huge gap. There's a digital divide as well as a educational or academic related divide that are co-current in our households, and it's a bit of a challenge, and we won't know until later. But I will tell you that anything we can do to offer tutorials, anything we can offer to begin to have more dialogue in and around like this to raise levels of awareness, this must go on. And it's not just something during this pandemic early season, it's even in the aftermath of the pandemic. We're going to need everything from teletherapy to you name it. And it's going to require all of our collective partnership so that we can move forward. But I do want to thank you, Dr. Gigi, and certainly Dr. Yolanda Lewis-Ragland, Dr. Nicole Lang, and Dr. Javaka Moore. Thank you for speaking to the community that is in Ward 7 and Ward 8 and literally the District of Columbia. You've been fabulous. We don't have enough time, so I'm inviting you back, and we'll work it out, schedule it, where we can really drill down in a couple of different areas and really allow you to share more of your insight, wisdom, knowledge that you have. And thank you so much for what you do, each and every one of you, for the community. And so we will be signing off now. And thank you, everyone in Facebook land and everywhere else that has participated with us today. We hope that you will listen and you will think and that you will grow. But in the meantime, I want you to stay safe, wash your hands, and make sure you wear a mask. So take care. God bless everyone. Bye-bye.